Great. Hi. Thank you for joining us on today's webinar, everyone. My name is Rihanna Putnam. I'm the Community Engagement Specialist for the Citizen Science Association. I'm joined today by Camille Niebaker and Gary Wolf, who will be presenting this webinar on behalf of the Ethics Working Group. We're going to be exploring some ethical dimensions of participant-led research. Just a little bit about the Citizen Science Association for those of you that might be new to us. The Citizen Science Association is an organization that serves practitioners from across the field of citizen science, people who work by, for, and with members of the community to collect scientific data. Our efforts are centered around a biennial conference that we just completed this last March in Raleigh, North Carolina. We have a peer-reviewed open source journal that you can access on our website. And we also have working groups and other member services, such as a monthly newsletter and some online resources. Our membership represents the multidisciplinary and multidimensional nature of the field. We have folks from project leaders, evaluators, researchers, and a growing number of members of communities that are doing community science in their own areas that represent members of our organization. These folks help build our member services and can join working groups and do have other member benefits such as conference discounts and receive monthly newsletters, access to online networking tools, and etc. Our working groups represent the core of our organization. They really help us to advance our goals through sharing of resources, best practices, and relevant information, both among the working groups through regular calls and also to the broader citizen science community through webinars like these. The Ethics Working Group has been especially active in creating online content. They have worked over the last year to create a series of webinars on ethics, all of which can be accessed through our YouTube channel. You can access that through the link below, and there are 3 previous ethics webinars are there. The Ethics Working Group also has a lot of great resources available on their website. I'll link to that in the chat box here shortly. We do have another webinar in this series coming up. Next week, we'll be featuring one of our organizational members who will be presenting on volunteer engagement. The University of Minnesota Extension will be taking a wide-angled lens on volunteer engagement, presenting a model that they've developed to help increase and retain volunteers for your citizen science project. If you're interested in that, you can register through the link on our website there below. Lastly, we do have everybody in listen-only mode. We have a lot of people, or expecting quite a few people on the call today. However, we do encourage you to use the chat. And so to access the chat, you can do that down here. If you don't see it in the bottom like this, there might be you can click on more to find the chat window. We do encourage you now to list your name and maybe your project role or where you're from. Otherwise, introduce yourself there. We'll be asking some questions throughout, and it's a good way to engage with our presenters. So if you have any questions as they come up, feel free to direct them to the chat box, and I will flag down our presenters and pass your question along. There'll also be some time at the end of the presentation for further questions if you have them then. And with that, I'm going to turn it over to Camille and Gary to present on ethical dimensions of participant-led research. Thank you, guys.
Thank you. It's a pleasure doing this webinar, and especially to have a chance to do it with Camille. And before I start, we're going to split up the presentation, but Camille, do you just want to introduce yourself in case you know, people didn't have a chance to look?
Yeah, sure. So I'm Camille Niebaker. I'm a research ethicist working at UC San Diego in family medicine and public health. And I would say over the past 5 or 6 years, I've gotten very much involved in digital health and technology ethics and how technologies have really expanded the ability for different types of people to be involved in academic research, whether they're academics, tech sectors, and more importantly, just the huge growth of opportunities for citizen scientists, broadly speaking. So beyond crowdsourcing and academic citizen partnerships to supporting people that are involved in do-it-yourself or biohacking or quantified self. There's so many different names that are being used, and participant-led research is something that Gary and I got involved with several years ago, and it was just a delight to be able to participate and help think through what are the ethical dimensions of doing self-study. And I'm really interested in helping to support the community, and so happy to be here.
Thank you. Thank you. And just a word of background. So my name is Gary Wolf, and I'm the founder of Quantified Self, which is an international collaboration of users and makers of self-tracking tools who share an interest in self-knowledge through numbers. And that community has grown over the last 11 years and includes many people who are interested both in personal and in generalizable health knowledge. So there's a border between the individual learning and kind of the group or collective learning. And that shared interest, partly because many people who are involved in Quantified Self have a vocation in either science or clinical research or public health, policy, tech, journalism, that kind of combined interest in both individual and generalizable knowledge has brought us into many situations where the attentions on that border are very real and very practical. And when we set out to do a small collective self-study of our blood lipids, we knew already from some experience that we had in the past that the question of how to create an ethical framework for this self-study was going to be important to address. And Camille, as part of the community, we sort of informally talked to her, and she became part of the run-up to that project. And then we were able to do the project with one of the participants themselves being familiar, deeply familiar with the context of research ethics. And so the webinar that you're about to hear, although it has some general framing and attempts to present some general principles, also really is about practical lessons learned over 11 years of focusing on this kind of work, but concentrated lessons also from the last 2 years of actually carrying out a fairly deep project in participant-led research, which has led so far to 2 publications, one on the ethical framework, but also one on the substantive discoveries that we made, which I won't talk too much about since that's not the focus. But I do think we succeeded in creating a context where people could do both personal and generalized learning. And the ethical framework for doing that was really important to try to get right. So now with that intro, I'm going to share my screen, and you'll notice on the slides there are some discussion points that we're suggesting. And so I will make sure to stop there and just see if something has come up in the chat that will be worth talking about for a few minutes. And then once we're through with the slides, we also will have a chance to discuss. Now let me just make sure that that you can see these slides. Are they visible? Great. Okay, good. So we're going to talk about approaches to governance of participant-led research. This is us and our contact information. It will be easy to find after the webinar. Here's the plan of what we're going to talk about. We have 6 short sections. We're going to give our definition of participant-led research because there is some ambiguity definitionally. We'll talk about the roots of PLR in the Quantified Self community. We'll talk about why we felt a need to develop an approach to ethical review and why not just use an IRB that some of the participants in the group did potentially have access to. Then we'll talk a little bit in more detail about the PLR that we did that centered around unusually high frequency testing of our blood lipids. Some participants tested them as often as once an hour. And then we'll talk in the most detail in section 5 about how we handled the ethical review. And finally, we'll present some principles that we abstracted from our practical process of ethical review and that we hope will be at least a basis for extending this style of ethical review as PLR grows as a research practice. Okay, what is participant-led research? We define it as a collaborative form of investigation in which researchers and participants are the same individuals. And there is some academic literature about PLR. It's not extensive, but our definition is coherent with the other definitions that are out there. For instance, PLR is distinctive as being initiated and conducted by the participants themselves. That's Effie Vahena, who some of you may know. Now, as people interested in citizen science, you might ask, where does PLR fit in the context of citizen science? Because we know that in citizen science, what defines citizen science is the participation of non-professionals in the scientific enterprise in a range of different ways. So one way you can understand PLR is as a kind of a domain of citizen science that on the continuum of participation is at the very, very high end. So in participant-led research, participants play essentially all the roles in research, not just one or two or three of the roles. However, there's an additional difference between participant-led research and most citizen science that's worth underlining. Most of the time when we think about citizen science, we think about participation of citizens in investigating scientific questions which are defined by a scientific field or a scientific discipline. What makes it science? What makes it science is that there is a community, a scientific community, a scientific discipline that's defining what are relevant questions. Participant-led research is conducted by people who are not necessarily responsive to any particular scientific discipline. And in that dimension of participant-led research, it sometimes doesn't appear to be science at all. And in fact, there have been some investigations of citizen science, which we cite in our paper, which don't see self-collected data, self-collected health data, looking into personal issues that you can use empirical methods to understand as being citizen science at all, because it's not capital S science. So one of the ambiguities that we had to address in our ethical review was the very question of whether PLR is science and is governed by the same principles that human subjects research and science should be governed by. So that's one of the things we'll address in this webinar. I want to just open and pause for a second and see if anything comes up around the definition of PLR and citizen science before I go on. Camille, is there anything you'd like to add?
I'm just checking on this, checking on a comment that was posed. How is this different than community science? And is the definition of PLR focused on participants being human subjects? And I don't know if you want to address that now or if you want to wait just a little bit.
I think we'll wait, but I do think it's a very good question. And one of the things that we encountered in attempting to understand, well, what intellectual resources are available to us in understanding what's appropriate ethical review of participant-led research is that there are many, many, many definitions out there. And things like community science, action research, et cetera, there's really a universe of approaches and also a universe of disciplines ranging from, community-based health research to urban planning, in which citizens have been involved at varied degrees of participation. And so it's not at all an established landscape in which there's clear boundaries and clear terminology. So I think this is a very good discussion point.
Yeah, and I think specific to participants being human subjects, I'll get into that in just a little bit in terms of the federal definition and how we're kind of not quite fitting into federal definitions, but that doesn't mean that we should be thinking about this carefully.
And one more comment is I think the troubling word there, or the word that makes it not easy to answer, is subjects. So let's continue.
Thanks.
So PLR, as we do it, has its roots in the Quantified Self community, a global community of individuals united by an interest in self-observation and self-experimentation. Quantified Self started in 2008, and it is a generally volunteer-run community supported by a very small staff that does things like maintaining the archive of projects that people are doing and publishing to the web and holding convenings. And recently, over the last 2 years, we have focused on organizing the documentation from this community. So we reviewed over 1,000 records of presentations that have occurred at Quantified Self meetups around the world in over 30 countries. We identified over 500 that had the ability to be archived in a way. They were coherent enough to go into the archive, including having a video record. We transcribed them all, tagged them all, and published them all to the web. And here are 4 examples which give you a sense of the kinds of things people are interested in our community. The first, The Data Is In, I'm a Distracted Driver, is a project in which somebody investigated whether they were on their phone and in their car at the same time. The second is Tracking Glucose as a Person Without Diabetes, is an example of somebody who was trying to understand the effect of their blood glucose level on the way that they felt, even though they weren't trying to manage their blood glucose level as a consequence of managing diabetes. In the third, a person tracked the improvement that they made using home technology after being treated for sudden hearing loss. And in the fourth, an example from our blood testers project, somebody tested their, one of the participants tested their blood cholesterol levels, both across the course of days and across the course of months as she returned to regular ovulatory cycling after giving birth. So this is a really great example of the range of topics of personal questions that people have that are driving them to use the kinds of empirical methods that are used in science, but in the service of individual personal questions. You might ask, why are people doing this? And I won't talk too much about that, but I'll just say that we can discuss this in the discussion time at the end, but people have a range of motives, from trying to solve a pressing problem to simply being curious. And this range of motives is one of the things that makes the Quantified Self community an awkward fit with, for instance, the clinical research community, because many of the questions do not count, in a sense, as clinical questions. Why could we not use an IRB when we attempted to help people investigate personal questions about their blood lipids in a small group? Well, research led by participants presents challenges to traditional methods of ethical review. One of the challenges is that our relationship with academic institutions is quite unconventional. You might say that a PLR has no relationship with an academic institution because it's not centered in an academic institution and it's not led by somebody who has an academic position. However, that would be inadequate because many of the participants are actually academics and therefore have professional responsibilities to conduct themselves according to the ethical guidelines in their professions. Also, one of the things that our academic participants and clinical participants would like to do is use the research that they're doing about themselves and the small group research to influence progress in their professions. That means that they may want to publish about PLR. And publishing about PLR depends on being able to demonstrate that you've done PLR ethically. So our relations with academic institutions are neither absent nor fully present, but in some awkward new in-between space. An additional practical challenge is that PLR is not necessarily funded to pay for IRB review. and nor are IRBs funded to just help citizens perform ethical review of their research. So we actually have a kind of money institution workflow problem that sometimes can be hard to solve. There are also philosophical challenges. The ethical requirements that are typically present in a conventional IRB review may be different than the ethical requirements in a PLR. And this is one of the things we have attempted to investigate. For instance, just as a quick example, there are some issues with returning data to participants. What if that data is dangerous to them, for instance? And our collaborators have found that simply stating that participants are going to control or have access to all the data in the study creates questions in the minds of the IRB. Whereas for us, this is a fundamental principle of participant-led research, which is the participants control their own data. So there may be conflicts or at least ambiguities in the ethical requirements. At another level, there is also the question of who is authorized to make ethical judgments in PLR. It's clear in an academic research context that the IRB has institutional responsibility for guiding those ethical judgments and for ruling on whether they've been properly made. In a PLR, that's not so clear. Is every participant on their own and responsible for their own ethical conduct? Does not the existence of the group imply some necessity of a group responsibility for ethical conduct? And does not the participation of clinical and research professionals in the group imply some responsibility for judgment on the part of their discipline or their institution? So these are some of the conflicts. Our blood testers project grew out of years of informal discussion in the Quantified Self community about the reliability and validity of various biometric assays in general, and the meaning and value of home cholesterol tests in particular. Our questions included how easy would it be to do common blood lipid tests more frequently at home, and also how to diet and exercise affect cholesterol on short timescales. And if you think about these questions, you can see how they emerge from people's own personal individual experiences. For instance, something that has come up in many of our Quantified Self meetings is, I've gone to the lab and I've gotten a test, and that test implies that I should undergo a certain treatment, but is that test accurate? What if I went in and did the test again? Would I get the same number or would I get a different number? But when I asked to do the test again, I'm told by my healthcare system, I've already had that test, so there's no reason for me to get the test again. Boy, it would be interesting for me to do this test at home. And I raise this example because it shows that even access to the measurement itself, independent of an experiment that would lead you to draw conclusions about the measurement, has value to individuals who are curious or concerned. The second question, how to diet and exercise affect cholesterol on short timescales, this is actually less a kind of health intervention question than it is a meaning of the measurement question. Because another question people have about these measurements is, but wait a second, I went for a big run before I went in and had that test. Could that make a difference in the value I received? So again, I'm pointing out that people have a very large range of questions about the data that they can collect that are not necessarily matchable to a healthcare intervention. When we designed blood testers, our goal was to do two things. On the one hand, increase and improve people's capacity to answer the questions that they had about themselves related to blood lipid measurement. And two, see how working in a group could shed light on the nature of these measurements that itself is interesting to individuals. Does the group add something? So this was our attempt to build from a kind of N of one to N of several ones. I just want to give you a couple of quick examples of the intersection of personal and generalizable health knowledge in a PLR. One participant in our group, a 35-year-old healthy male, took hourly triglyceride samples from 5 in the morning until midnight and recorded his perceived hunger on a 4-point scale. The participant found an inverse association between his triglyceride level and his hunger that persisted even in the absence of recent food intake, suggesting that he was undergoing kind of rhythmic hunger episodes that were associated with his biometrics. A really interesting result. Another participant, a 35-year-old healthy female, took daily fasting samples between the hours of 7 and 9 a.m. on each day of her menstrual cycle. The participant recapitulated at a seemingly unprecedented resolution the menstrual rhythm of total cholesterol, i.e. you saw a cycle of rise and fall over the course of the month that actually moved her across risk categories. And when I presented this, by the way, at a meeting that included many cardiologists in the audience, I talked about this and people said, look, we've known this for many years. This has been shown in mice, it's been shown in humans. This is hardly a result that's worth getting. You could have looked it up, and seen that there is menstrual variability in blood cholesterol. But when I said, okay, fair enough, how many of you as cardiologists keep track of one of your patients' menstrual cycles in order to determine whether the cholesterol level is actually a risk of cardiovascular events, because it may have been taken on a day of the cycle where it's high or a day of the cycle that it's low? Not a single person raised their hand. And so my question was, well, then what does it mean to know something? And I think this highlights a really interesting place where PLR and conventional human subject research in the health sciences kind of interact. PLR may be investigating questions that have no disciplinary interest because they've been known for 50 years. In a sense, this is already known. On the other hand, they're investigating them from the perspective of individual participants who really care a lot about whether they're true for them and whether their doctors apply the scientific knowledge that's been out there for decades when it comes to thinking with them about what a proper course of treatment is. So this lies as a discussion point kind of in some definable, perhaps, but still undefined intersection between personal and generalizable health knowledge. Now, I'm going to just lead up to Camille, or you're taking over. Would you like to take over now or at section 6? I forget. I think now.
Yeah, I can start. I can go ahead and start now.
Good, very good. Okay, I'm going to hand over to Camille because this is where you come in.
Yeah,
Sure.
So back when we were first starting to conceive the blood tester project, I had known Gary for several years through the Quantified Self and public health meetings that had taken place here at UC San Diego. And he was really curious about how do we build in an ethics foundation as part of the blood testers project. And so our main question was that of respect for others. So thinking about the ethical principles of the Belmont report, respect is demonstrated through the process of informed consent, which is typically a researcher interacting with a research participant. And that didn't really quite fit with what we were doing with this self-study N of 1 group cohort. So we were asking, can a process of self-consent be used by participants to evaluate their decision to participate as a member of the cohort? And what would we need to think about and evaluate to make an informed decision as individuals, but also as individuals as part of a group? And really thinking about, are the bedrock principles of biomedical research applicable to the use of, or applicable to self-study and participant-led research? So could we use that as a starting point of thinking about our next steps? Gary, I'm not sure if I can advance these.
Oh, here, I'll drop
Okay.
it.
So at the very beginning, we had basically a pilot phase of setting up the protocol of how we were going to do this. And that, I'm going to say, took place for probably about 5 months, where we thought about what is it we're trying to accomplish, what equipment will we use to do the daily blood testing, what kind of training will people need in order to use the equipment in a way that's going to produce valid and reliable information about blood lipid levels. So during that initial phase, we did a lot of work, even to the extent, like, I'm not somebody that draws my blood routinely. And so I didn't know how to dispose of the products that were waste products at the end of drawing blood. So there were a lot of things that we had to think through so that we could create a protocol that was really thoughtful. But then when it came to how do we decide about participating, we decided to convene the group on a webinar just very much like what we have here. And during the first meeting, and we did meet twice to go through this process, we started out talking about what the risks are. And one of the things that I was really conscientious about, because I've spent 20 years as an IRB member, so I'm really aware of how IRBs think through the probability and magnitude of potential harm and evaluate that against potential benefits, that I really wanted to not just focus on risks and risk management, but also think about what are the benefits of participating in this type of a study. And as a group, really talking with each other to make that process come alive. And so this was a living document that we created that documented what participants were thinking about risks, how those risks could be mitigated, but also what were the benefits to the individual as well as potential benefits to learning about how to do participant-led research. Next slide. So once we had gone through that process of phase 0 and we had created this protocol, the part of exposing risks during this reflection period included people who had some concerns about their privacy. So they had the opportunity to share their data on an Excel spreadsheet. They could lock their own data. They could open the lock and share their data with other people. Would peer pressure potentially encourage people to share data that they weren't quite comfortable with, or could, in fact, peer pressure influence somebody's willingness to participate at all? So would there be some type of coercion just because of the group being a group from Quantified Self and not wanting to disappoint others? They also were concerned about the value and accuracy of the measurements. And I know at one point when I started using the cardio check device, and Gary mentioned this, like after a long run, I had gone to hot yoga and come back and my values were significantly different from when I went before yoga to after yoga. And then 30 minutes later, checking it again. But one of the things that we discussed is I had tested my blood in the living room and then I had gone to the kitchen. So is moving the device from one place to another potentially introducing noise into the data that needed to be controlled? And so our co-author and colleague, Azure Grant, had been very, very meticulous about creating a protocol and testing each individual who was interested in participating on how to use the device, when to use, how to record data so that their data would be as accurate as possible. Also, how to do the finger prick testing. So there is pain when you stick a needle in your finger many times a day. How to get the bleeding to happen. Sometimes if your fingers are incredibly cold, you won't have any blood come out. So we had to kind of think through from a protocol standpoint and as well as a risk standpoint how this works. But then also, what does it mean when you potentially get bad news or what might appear to be bad news from the values that you're seeing? And so these were all information points that we discussed as a group to think through how do we mitigate the potential for risks that we uncover during the self-consent process. Next slide. So when we thought about how to mitigate these harms, the privacy issue was something that we could control by making sure that participants had complete control over their data. Some people used the shared Excel file, some people didn't. Making sure we acknowledged the potential for peer pressure and to encourage people to be guided by their own goals. This was their own study. They could design it in a way that was fitting for them. That they also got the training and support. And again, this refers back to what Azure Grant had really focused on, making sure that the protocol for how to do the blood collection and data recording were really meticulous. There was also concern about reputational harm. If we do this in a way that's not rigorous and that isn't really thoughtful, it introduces the potential for people to question whether or not this is actually a responsible practice. And so we also thought through how to adjust our protocols based on what we experienced in the first week or two of collecting data. Was it reasonable if you had bruises on your finger to maybe choose to record data less frequently? And in advance of learning something that may not be good news, how do you prepare for that in advance? And again, this was a very low-risk observational type of study. There were no interventions. It was all single-subject design. And the other thing that we really focused on, because some people were academics who had training in the scientific method, we could leverage that experience to help other people. Now, other people were very well trained, but had no formal academic research training. And so we were able to help with identifying what a hypothesis was, research question, how to organize data, how to analyze data, how to visualize data, and how to make sense of the results. So all of these things were worked out through group conversations. Next slide, please. And again, benefit to participation was something that it's equally important. A risk to benefit analysis is how IRBs make decisions about whether a study should move forward, and we wanted to really think through how do we apply the same principles that are being used in a formal ethics review to what we were doing so that we had the framework and we had the foundation for moving this forward thoughtfully and responsibly. And so, understanding lipid physiology and its relevance to health was something that was important. We were able to develop that over the course of the self-study, and Azure had put together some really beautiful animations that are now published online that you can have access to better understand lipid physiology. And again, assistance with conducting the self-measurement process was something that we were really interested in, whether we were working with, doctors or architects or engineers. They had domain expertise, but maybe didn't have the expertise in designing a study from beginning to end. And so we were able to pull together the experts to help with that process. And then also getting help with making sense of the data. And so all of these dimensions influence the risk to benefit balance for our study. Next slide, please. And so what we did, in addition to having these two group discussions, we did one before the study really got launched, and we did one probably, I think it was in August, September timeframe, about 4 weeks into the very beginning of this process, to get more input from people about what they were thinking about, how the study was going, other things that had come to their awareness having participated in it for a little bit. And then at the end of the study, we conducted interviews with all of the participants, individual interviews. And what we learned from analyzing those data qualitatively were how to basically govern the participant-led research experience. And so these 9 principles were the result of both the 2 webinar about assessments about ethical reflection, but also the individual interviews, which are published in this paper that came out in BMJ Open a couple months ago. So transparency was a key element, and basically that's just focusing on anything about the study that could influence a person's decision to participate needs to be accessible, available, and explicitly shared with the participants in advance. Access to expertise, this was really making available experts who could support the benefit of participating in a well-designed research study. Data access and control, focused on the participant control of their own data. The right to withdraw was encouraging participants to really think about their participation and making available their ability to change their mind and stop participation at any point in time without any repercussion. The research questions are really what is meant by relevance. We wanted to make sure that the research questions that people sought to answer were personally relevant to them, which makes it more meaningful and something that people actually can, answer a question about their own health and well-being. Beneficence is a principle that we've talked about in terms of the Belmont report, but really actively reflecting on the benefits in relation to the potential risks of participating in the study. The principle of responsibility that we have here is that a PLR requires continuous engagement, not one-time consent. So we did this process of community reflection at the very beginning, but we continued that process throughout. And participants, if they weren't able to participate in a webinar, we used Slack, which is a team tool that everybody on the PLR could choose to direct message people or choose to communicate to the entire group about questions that they had. They had access to the webinars through video recordings. There were also continuous group meetings that were convened so that if you couldn't make it, you could access that information. But if you could make it, then you had the benefit of engaging with the group in conversation about learnings that are taking place. Flexibility is the process of reflection should be tailored to the individual's needs. And that also came up in that when people designed their own self-study, sometimes it was too rigorous and they weren't able to keep up with it. So flexibility really was focusing on, can people change the plan? And that happens in traditional research all the time. You can have a study where this is what you're aiming to do, and then you realize in practice it's just not feasible. So you make adjustments, and we would talk about those adjustments and how to integrate them so that they would, that we would document the potential impact on the data so that we could make sense of it down the road. And inclusivity is really the prospect of participants being willing and able to uphold the principles of PLR, and that those that really embraced this idea would be welcome to participate. And so these are the principles of governance that we developed as a result of the blood tester study. These are, the beginning steps that we think are really important, but they certainly can be built upon. And again, this was a process that was designed to incorporate what an ethics review board would typically do, but working with the group, working with the research/participants who were responsible for designing this study, I think was a really valuable lesson that I don't know, and I think this is a good place to open this up for discussion. The IRBs that I work with and that I know from across the country, this is not traditional. And I think in order to have a peer review, which I think is an incredibly important piece of ethics review, how do we incorporate that peer review process and make peer review available for citizen science, especially in the health domain, moving forward? So I think Gary and I are really interested in getting feedback from those of you on the call about how you're thinking about the ethics review process and comments that you may have about what we set out to do and what we accomplished. Gary, do you have anything to add?
No, thank you. I'm interested to see if people have comments and questions.
Yeah, thank you, Camille and Gary. That was really great. I appreciate you guys taking the time to share today. We have had a few questions come up. There was earlier some questions about for-profit IRB rewards and whether you knew of any that did reduced rates. I think there was some back and forth on the WIRB, but if you guys had anything to share about for-profit IRB rewards.
Well, I think, because several of us were academics on the blood tester project, we could have sought IRB approval from our own academic institutions and there would have been no charge. I think whether it's a for-profit or non-fee related IRB, the challenge is that the federal regulations aren't written for a participant to also be a researcher. I mean, the federal definition for a human subject, first of all, you have to be doing research, which is a systematic investigation designed to contribute to generalizable knowledge. So there's some question about whether or not this is intended to contribute to generalizable knowledge. That can be debated. Let's just say everyone wanted to contribute to generalizable knowledge. That would have been the qualifier to be research. So then you look at the federal regulations for the definition of human subject, and it is a systematic investigation to contribute to generalizable knowledge, where the individual is a living human being, where information is collected about that individual through intervention or interaction. So again, that person is separate from the research. The intervention is about them. So it's kind of like even trying to figure out, does this fit within federal definitions? That's what IRBs are charged to implement, is that federal definition. This also gets it's a curious situation because federal regulations apply to institutions that are funded by the Department of Health and Human Services. So organizations like Microsoft or Facebook that are conducting research with human beings, they don't have the same rules. Similarly, do-it-yourself, participant-led research don't have that federal regulation to guide. So by using an organization that is charged with implementing federal regulations, it's hard to fit a square peg into a round hole, vice versa.
Yeah, I think that kind of leads into some other discussion points that folks are raising about how to take into concerns of people of color and that have been marginalized or perhaps taken advantage of in research situations, and how PLR, or taking in ethical considerations when doing PLR, how it might resolve some of those issues, or whether those issues are still present even with some sort of oversight internally or externally.
You know, and Gary, you can speak to the demographic of Quantified Self and that community. The people that I've observed over the years, it's tends to be higher SES, higher education, people who are interested in doing self-study. Seems it's not a representative group of people at this point. I think teaching the broader community, the broader diverse community about the scientific method and how they can be much more involved in the research process. I've been teaching community health workers in the San Diego area, primarily monolingual Spanish speakers, about the scientific method so that they can be better advocates for their communities when they're approached to be involved in community-based participatory research. Learning how science is conducted and then being able to be better advocates, not only for themselves, but for their community, is, I think, a step that, Quantified Self and participant-led research can move in that direction. But we would be building off of community-based participatory research and community-engaged research, and really trying to help people better understand their own decisions and the effect of those decisions on health. I think that would be super exciting to see more of that.
And maybe I'll just add that I think what we're doing is potentially very useful to anybody who would like to support or do research in which the participants in that research are have as much agency, are at the extreme end of having as much agency as is possible in research. And taking that approach that really this is kind of in the ladder of participation, this is trying to get to the top rung. I do think that that presents an opportunity for people who are working with historically marginalized populations, for whom traditional ethical review of human subjects research is mainly approached in a mode of protecting them from harm and exploitation from empowered researchers. I mean, that's extremely important, obviously, because these institutional powers and social powers are enormous and weigh heavily on these communities and potential participants. However, our approach, it really comes from a different direction. And I think there's a lot of work to be done there. It would be very interesting to do it, in which communities really generate their own research questions, and yet at the same time have an interest in protecting themselves. And so one of the things that we did in our process of ethical review, which is very unusual, is that one of our goals was to expose novel risks. Okay, we can think about the risks that are easy to think about, but are there some risks that are hard to think about? Like, let's really challenge our imagination and ask, what are some risks that normally would be unaddressed? And I think that question of what are the risks that aren't even framed by conventional ethical review of human subjects research is potentially very productive in communities that are historically disempowered.
Great, thank you. And for those of you that were chiming in on that, if you have any other clarifications or points that we didn't address, please post them in the chat. Jonathan has a comment or a question saying, regarding inclusion, there was concern within my group at NASA that Citizen Science Association initiated a CSA would be offensive to persons of color. Has this been brought up before? Obviously, an unfortunate coincidence, but potential participation could be rebuffed by the Association of the Confederacy. That's not, I'm pretty new to CSA, if that's being directed to me. That's not something I've encountered in terms of the acronym. But I don't know if other folks, I know that there has been discussions around the term citizen and whether that is the best term for this, but I think we might perhaps table that for a different time. I think that that's perhaps a larger question.
Well, I don't know if this is a response to that question, so Jonathan, please let me know if you have some thoughts on this. But as an IRB member for a long time, I was always really curious about how our deliberations as a group of semi-privileged people could assess risks for people that weren't represented on our committee. And oftentimes I thought we were preventing people from having access to important health research. And because we were imposing what we thought might be potential harms to people without having consulted with them. And then we would approve a protocol, we'd approve a consent form, but we would never check back with that community to find out, did we do the right thing? Did we actually protect you, or did we hinder the advancement of research that could have really benefited you and people in your community? So I think based on our current system, we do not engage the public to the extent that I think is beneficial. And I would love to know who had identified the CSA as being offensive to people. Was it people that were representative of those or not? So just based on my experience, I think that we really don't have a participatory process where it could really be helpful.
Yeah, and I guess I was confused by that question, whether it's the acronym that was offensive or if it's the association or the term. So maybe some clarification there. Just the acronym. Okay. Yeah, that's what I thought you were referring to there.
I'm curious from the people in the group, how might we see an IRB/peer review process that serves the CSA community moving forward? So rather than seek out the traditional IRB, what would it look like if we had a registered, like a government registered IRB that was really well-versed in how diverse citizen science and engagement of people in participant-led research? Is there a need for this? Who would use it? How would we move it forward so that we had that peer review process?
So, and perhaps while we're waiting on some responses to that, I'll give folks a minute or two to kind of type in. It looks like there's a question about, are there any challenges to informed consent based on the possibility that personal health data collected over the platforms could be used for purposes other than what it was originally collected for? Is there any risk in the data could be assessed by like insurance companies or outside groups?
Camille, do you want to take that, or would you like me to?
Go ahead. Yeah, because I think it has to do with data security.
Yes. So one of the interesting discoveries in exposing our style of collective and participant-led research to the more academic research community was being exposed to the immensely insecure procedures that are used in the academic research community around large aggregations of data, and how inadequate it seems the oversight of these aggregated data platforms. And just to give you an example, what we saw happening in IRB review of research was the IRB reviewing the academic side of the management of this data, so that once it crosses over into the researcher, then it comes under the governance of that institution. However, the tools that are increasingly being used, the consumer tools, speak to many entities and drop data into many data stores that never cross over into the academic data store situation, and therefore are governed by the terms of service of the commercial companies. So what we noticed, to our surprise, since we're not well versed in academic management of human subjects data, was that they were governing a small amount of the data that was under their direct purview while leaving most of the potential harms unaddressed. And when I raised that issue, I was told, well, of course we leave most of these potential harms unaddressed, because we're not empowered to have oversight over Microsoft and Google, and they are doing their own thing. And so we really are just trying to make sure that we don't do the wrong thing. Now, from the perspective of our participants, this is not adequate. They're concerned about the potential harms to them. They're not concerned about who is responsible in the decision tree for what piece of what. That's why in our approach to participant-led research, attempting to make it conform to kind of high-level ethical principles, we actually did not create aggregated data stores. And our goal was really to encourage people to do a certain kind of collective and collaborative research that didn't expose them to platform risks. I think that's a very extreme approach, but I think it's worth at least advancing as a provocation, because I do think there are potentially unaddressed harms to participants that are not being really well characterized by the conventional oversight of human subjects research.
And I just want to note that several people have written in, so I see comments from Karen Cooper and Matt Ball that I'd really like to address. I know that we're out of time. We've hit 11 a.m., so I want to be respectful of time for everybody, but I do want to let you know that we will respond to questions, and I'd like to, I'll talk with Brianna to find out if there's a public forum where we can respond and make that available to everybody.
Sure. We can also just open it up if folks would like to hop off now, if you have other engagements, or if Camille and Gary, if you have other engagements, we can end it now. I'm okay keeping the webinar going a few more minutes if you want to wrap up some of these questions. The webinar will be recorded, or has been recorded, and I'll be posting it to our YouTube channel in the next week or two once we get it downloaded. And so if you're unable to follow up that way, you can check back in the recording for responses.
I'm glad to keep this discussion going for a few minutes.
Is that all right with you, Camille, or would you prefer?
I have an 11 a.m., so let me see if that person's here, and that will decide if I can stay.
Sure. Yeah, and given that this was a pretty lively chat with lots of folks posing some questions and reflections, I will download this as a file, and I will try to send it out to everybody that was on the call today when I send out the YouTube link. And so just check your email in a few days, and you should be able to get that. I think some folks posted some links earlier that looked really great. Once you close out of Zoom, the chat window will disappear and you won't have access to that. So if there were anything that you wanted to click on, be sure to do that before you leave.
But in response to Matt's comment about one thing I'd like to see in PLR-oriented IRB is much more transparency, I think that is such an essential part of this. You know, the tossing an IRB protocol over the fence and hoping for the best and having that separation between us and them has been something that in traditional research I've resented, because I'm on both sides and I just don't see it as a collaborative, meaningful way to make decisions. So as we start to create a PLR, IRB peer review type of process, I think making it open is critical. And you know, the CSA, through the work that Chris did, putting an IRB process up on the Open Science Network has been a step in that direction. Yeah, I think it's just really critical. And I think evaluating IRBs is also critical, but that in our traditional system is not likely to happen. IRBs don't like to be the subjects of studies. But I think moving forward, we can do this differently.
I can now see the chat window, and there's been a question about the certifications. And I think it's very interesting because this has come up for us as an organization a number of times, like should Quantified Self do something that would certify some of the activities that are going on in the community, validate them, you know, permission them. And in the end, our feeling was this is a dead end, because what we're doing is we're supporting people who are engaged in a process of self-directed research. So it's not clear what it would mean to us to say you are in some sense, there's a barrier between you and the self-directed research you want to do. You must transit through some domain that will deliver you a certification. I think we're going to have to deal with this. We're going to have to deal with this in another way.
So Gary, just to build on that, you know, I think about the community health workers that I've been working with over the past 20 years who are by definition considered key personnel in Department of Health and Human Services supported research. And DHHS requires that people that are considered key personnel receive some form of human subjects education. And that type of education has been designed for graduate students and academically trained researchers who are typically PIs, and it's really inappropriate for entry-level non-scientists to be exposed to pretty complex training. So what we did with support from the Office of Research Integrity and the National Institutes of Health is we created an entry-level curriculum to introduce the scientific method and introduce concepts of human research ethics in a way that was accessible to right around an 8th grade education. And it's in both English and Spanish, and universities are now using that as an alternative to programs designed for academic training in that area. It can, you know, I certainly think it can be an optional thing. It might be helpful for people that are curious about becoming more engaged in doing self-study to know how to think through that approach. It's a resource, I think, that we could develop and think through how that might be of service to the greater community.
I get it. I think this is very interesting, Camille, because now you're not really talking about the individual self-tracker or person doing a project for themselves. You're talking about, I mean, how we think of it is kind of allied professions. Mm-hmm. So you're talking about people who actually have some vocational, you know, relevance that would drive them to actually benefit from and learn from the academic ethics community. I think this is potentially very powerful because we see these individuals, not just community health, but physical therapists, nurses, teachers, all interested in how self-collected data can help people learn, and they're often responsible for groups. So they're not just dealing with one person at a time. So I
Right.
do think what you're describing could be really useful, say, for somebody doing something what if they're doing something in a 4th grade class and they're helping people collect some data and learn about themselves. Is there something that they should think about, at least in terms of data management and ethical governance?
And even in junior high and high school, there are practicums for learning about and doing the scientific method that require students to go out and interview people, and having that basic foundation of how the scientific method works is, I think, becoming part of our primary education system.
Right. This is a good idea that came out of this webinar, and I see Jonathan commented on it too, saying it could be offered to advanced research volunteers, and I think we should maybe, as we start to wrap up, hand this back to your community, and to say, like, that would be a big help.
Yeah.
So I've got to go now. I really enjoyed being a part of this webinar. Thank you, Gary, for putting it together, and Rayanne and the CSA for inviting us to participate. And I'm part of the CSA's ethics working group, which is responsible for organizing several of these ethics sections. So thank you, and I look forward to following up with questions that we didn't get to answer.
Please do stay in touch. We're very interested.
Yes, and I've just posted the link again to the ethics working group. If you are interested in getting involved, you can sign up there. They do monthly calls and plan events like this. It's really a great group with a very active membership. But thank you, Gary and Camille, and thanks for everybody who attended.
Rihanna, thank you very much for shepherding it.
Awesome.
Okay. Right. Bye, everybody.
Bye.